Hello, my name is Allison Forbes from Brandman University. Today I will be discussing Innovation Project Video Proposal on Advanced Trauma Life Support. Problem: lack of standardization of initial assessment and management by healthcare providers. There's a variable knowledge and skill level of practitioners providing trauma care in the emergency room. Missed injuries are often not identified on initial assessment. The location of the problem is mainly in emergency rooms at trauma centers across the country, and the trauma patient population is who is being affected. What would be different if the problem was solved? Standardized trauma care would result in timely identification of all injuries, decreased hospital length of stay, improved patient satisfaction, decreased morbidity and mortality, cost savings to the hospital and society. Background: the American College of Surgeons developed a program called Advanced Trauma Life Support, or ATLS, in an effort to standardize trauma care nationally in 1980. American College of Surgeons, 2014. However, ATLS is only mandated for trauma surgeons and nurses to maintain current certification while caring for patients at a verified trauma center. All other providers, such as consult services or emergency room physicians, are not required to have certification in ATLS, thus resulting in a variable knowledge base and skill set. Significance: health, social, ethical, and financial costs resulting from the problem. According to the National Trauma Institute, Centers for Disease Control and Prevention, 2014, trauma accounts for 41 million emergency room visits annually. Trauma patients represent a large portion of our hospital population and encompass a majority of the emergency room cases. More than 180,000 people lose their lives to trauma annually in the United States alone. Trauma results in an annual cost to society of more than $400 billion. Current literature: due to the high volume of trauma patients, missed injuries often occur as a result, causing a huge burden on the patients, healthcare providers, and hospitals. The incident rate of missed injuries fluctuates from 1.3% to 39% in trauma centers nationally based on the current literature. The missed injury incident rate leads to longer hospital stays, increased intensive care unit ICU length of stay, significant pain, residual or long-term disability, litigation, and even death. Pfeiffer and Pape, 2008. What solutions have been tried in the past? Well, transferring trauma patients to a verified trauma center. However, severely injured and critical patients must go to the nearest hospital available. Tertiary trauma surveys on all trauma patients. It's a fairly new concept and not widely adopted by hospitals. Advanced trauma life support training. It's optional to providers to maintain current certification. There's also standardized documentation templates that focus on accuracy and efficiency for evaluation and treatment. So, collaborators on this project. 3 of the collaborators interviewed about the problem were all members of a very busy trauma surgery service. There was a trauma physician, a new graduate nurse practitioner recently hired to the service, and an emergency room physician. So the trauma physician. The reason for selection? Well, they're the leader of the trauma team. They oversee and are responsible for all trauma management. Trauma surgeons are mandated to have ATLS training, as well as maintain current certification, whereas other providers are not. Contribution to the project. He offered feedback regarding the proposed mobile application, discussed how the variability in training and lack of ATLS certification amongst other providers impacted trauma care, and shed light on the barriers to mandating ATLS training for all healthcare providers. The new graduate nurse practitioner. Reasons for selection. The new graduate was recently hired to a busy trauma surgery service, and she would bring a new perspective. She's young, innovative, and readily accepting of incorporating new technology into current practice. She also had no experience, training, or certification in ATLS, with little or no exposure to current trauma guidelines. Contribution to the project: she was open-minded, willing to utilize the mobile application technology. She presented a viewpoint on ATLS training since it wasn't mandated for her or any other nurse practitioner to maintain a current certification. She also discussed barriers to maintaining certification, such as cost, time commitment, and convenience. Lastly, the emergency room physician. Reason for selection: he is a member of the trauma team. I wanted to get a perspective from a provider that's not formally trained in trauma surgery. And oftentimes, emergency room physicians are the primary care provider of a trauma patient in a non-verified trauma center. Contribution to the project? Well, emergency room physicians are not always aware of current new guidelines that come out on a day-to-day basis for trauma care. So I wanted to get thoughts on the value of ATLS training. I also wanted to get an emergency room physician's viewpoint on the ATLS mobile application. And lastly, we discussed barriers to minimal trauma training while managing the trauma population. So the mobile application selected was Advanced Trauma Life Support mobile application. How does this mobile application address the problem of lack of standardization and management? Well, it delivers the latest standardized guidelines determined by the American College of Surgeons and Committee on Trauma. It's a valuable tool aimed to reduce mortality and morbidity associated with trauma. It gives up-to-date concepts from Advanced Trauma Life Support course. It provides all healthcare providers, regardless of level of education, an alternative access portal to ATLS course content in both rural and developing world settings. It's the first groundbreaking mobile application available to meet both the needs of first responders in the field, such as medics, or in-hospital providers like nurses and physicians. It offers a great alternative for providers who are not mandated to be certified in ATLS to at least have access to standardized treatment algorithms and practice regulations. Internationally available mobile application consisting of interactive algorithms, calculators, animations, and chapter summaries. And the app is native to the device, so once it's downloaded, users don't need internet access to use in the field or if they're in the area of a hospital that doesn't have a good internet connection. This is just a table comparing the ATLS mobile app and the traditional ATLS course. The length, well, the ATLS mobile app, it's ongoing access anytime, whereas the traditional course, it's a 2-day course. And that's your only exposure to the course content. Access. Well, the mobile app is compatible with all iOS, Android, Mac, and PC platforms, whereas the traditional ATLS course is only offered at approved institutions certain times of the year. There's a huge cost savings as well. It's $9.99 per device download for the mobile app, whereas the traditional ATLS course is $800. However, it does include the textbook. CEU and CME education. Well, the ATLS mobile app doesn't offer any, whereas the course, you have 19 hours of credit. Certification, you can't get certified through the application. However, if you take the course, you get a 4-year certificate. And lastly, convenience. It's very convenient. The mobile app is portable and readily available on a phone, tablet, or desktop computer anywhere. whereas the traditional course only offers a huge, heavy textbook for the information and content. Innovative solution. Innovation is taking two things that already exist and putting them together in a new way. That's a quote from Bob Iger, the CEO of Walt Disney Company. So some of the innovative principles that I'm going to discuss that my project will incorporate are disruptive technology, which is an innovation that makes things simpler and more affordable using technology to foster greater value as an end result. Christensen, 2009. Also healthcare innovation, Omochonu and Einsbruch, 2010. The introduction of a new concept, idea, service, process, or product aimed at improving treatment, diagnosis, education, outreach, prevention, and research, and with long-term goals of improving quality, safety, outcomes, efficiency, and costs. Lastly, I'm going to discuss Power of Mobility, McGuire, 2007. There's 7 steps in the Power of Mobility, such as digitize, connect, evaluate, limit, position, protect, and learn. Innovative features. This project incorporates disruptive technology by integrating the technology of a mobile application as a solution to the problem, creating a cost-effective alternative to disseminating national trauma guidelines, and the technology is very user-friendly and intuitive. The project embraces healthcare innovation by aiming to improve training and education surrounding the management of a trauma patient while ensuring competency. ATLS is pertinent to everyone regardless of provider specialty, geographical location, or triage on the field versus emergency room. It achieves the goal of improving safety and patient outcomes by teaching a quick assessment to identify all life-threatening injuries and treat immediately in the trauma patient, therefore decreasing the incidence of missed injuries. This project includes principles of the power of mobility by digitizing, creating a process, in this case ATLS, that is mobile, connecting, allowing access to all providers to a wealth of resources, evaluating, determining the effects of project implementation on care, and learning, watching how the providers combine the new knowledge and technology into practice. That is a summary of my innovative project video proposal. Thank you.